Now let's take a look at cardiac output. So this is the amount of blood or the volume of blood that is ejected by each ventricle of the heart per minute. So the way that you can calculate a person's cardiac output is you can take their stroke volume, which is the amount of blood that gets pushed out of the heart with every pump, so with every contraction, and you can multiply that times their heart rate. So their heart rate typically on average is about 75 beats per minute for an average individual. Their normal stroke volume for an average individual is going to be about 70 milliliters per beat. So if you take those two things and multiply them together, you end up with just a little over 5 liters of blood being pumped by the heart per minute. So we know that basically the entire volume of our blood is going to pass through our heart every minute. So the heart uses a tremendous amount of energy to be able to pump that blood, and you have to think that it's doing it all day, every day, which is really, really impressive. So let's look at some things that can affect your cardiac output. We obviously know there are things that can increase cardiac output, and there are things that can decrease cardiac output. So ways that you can increase cardiac output is by either increasing your heart rate or your stroke volume. Now, in order to increase heart rate, we know that we can do things like exercise, we can do things like have high anxiety, have a stressful day, things that stimulate your sympathetic nervous system. This is the branch of your nervous system that's known as your fight or flight branch that's going to be activated during really high stressful responses. When that branch of the nervous system gets activated, it releases norepinephrine and or epinephrine, and those hormones will stimulate the heart to increase your heart rate. And so if your heart rate goes up, that's going to increase cardiac output. The purpose for that is because cardiac output, if you increase that, you're going to pump more blood to your cells, and theoretically you're going to be able to get more glucose and nutrients to your cells, more oxygen to your cells, so that you can survive in that stressful fight or flight response. We also know there are certain types of drugs or medications that we could take to increase heart rate. Things like nicotine and caffeine, stimulant type drugs, can increase your heart rate as well, so that can affect cardiac output. We know that we can increase stroke volume to increase our cardiac output. And the ways that we can do that is through using calcium, glucagon, and certain types of medications to increase that stroke volume. We also know that the sympathetic nervous system will not only increase heart rate, it can also increase stroke volume as well, which will increase the overall cardiac output. Now, there are also things that can decrease our cardiac output. Some things that can decrease our heart rate would be our heart being stimulated by the parasympathetic branch of the nervous system. That is our rest and digest branch. So when that branch stimulates the heart, it's going to tell that heart rate to slow down or calm down. If you have too much calcium or potassium, if you're like overdosing on those two minerals, that can also cause heart rate to slow as well. There are things that can decrease your stroke volume or contraction strength. If you take too much potassium or calcium, if you don't have enough oxygen available, the muscle cells are not going to be able to contract as strongly as they should. And so oxygen deficiency is a big cause of lower stroke volume or lower cardiac output. We also know that if your blood pH is too low, if it's extremely acidic, that your heart is not going to be able to function as well in pumping that blood out, and so stroke volume would be decreased in that case as well.